My name is Valentine Shena, and I'm here to perform a video for Safe Prenatal Precautions. And I will start by introducing myself. Valentine Shena, and may I use your wristband to confirm your name and date of birth? That tallies with my record, and I will provide privacy and perform heart hygiene. So the doctor indicated that you're newly pregnant, and congratulations on that. And I'm here to give you precautions on safe pregnancy and recommendations that will ensure that you carry your pregnancy to term. So I will start by giving you a list of food that you need to avoid to be safe. So you need to avoid raw, uncooked meat, seafood, eggs, and you need to avoid unpasteurized dairy products and cheese. You also need to avoid unwashed cat produce, because these carry the risk of carrying bacteria, which like Salmonella and Listeria, which can cross over to the placenta and to the baby, that can cause developmental issues like breathlessness, stillbirth, preterm labor, paralysis, and even miscarriage. You also need to avoid this produce, all the risks I've given you, because it causes toxoplasmosis, which causes infection, and that can cross over to the unborn baby. Toxoplasmosis can cause miscarriage and developmental issues, so you need to avoid all this. You also need to avoid high mercury containing fish, which will include shark, king mackerel, swordfish. The mercury can cross over to the placenta and cause developmental issues and neuro issues. Excessive caffeine is also discouraged, which can cause low birth weight. And do you have any questions so far? So you also need to avoid taking certain medications. And any new medication, you need to consult your doctor before starting any medication. You need to weigh risks versus benefits of the medication that you're about to take before you do. There are safe medications that can be taken, which include prenatal supplements such as folic acid. There are vitamins that are recommended, which the doctor will obviously prescribe. There are also medication like acetaminophen, Tylenol, antacid like Tums. Those are safe for pregnancy. Second generation antihistamine like Claritin are safe for allergies, but you also need to learn it through the physician before you start taking any new medication. There are contraindicated medications which are tetragenic. These include all NSAIDs, including Advil, Motrin, naproxen. Aspirins should be avoided at all cost. You also need to avoid acne medication, all the ARBs, ACE inhibitors. You need to avoid lithium. You need to avoid warfarin. You need to avoid oral contraceptive medications. And what else? All these are medications that will cross over to the fetus, and they can cause birth defects. Supplements like black licorice, excessive intake of vitamin A and E, all these will cause birth defects. You also need to avoid there are environmental conditions that you need to avoid, like excessive heat, which include sauna, hot bath, and excessive exposure to hot sun. These will cause a lot of dehydration and preterm labor. And remember to keep hydrated just in case. You also need to avoid to avoid lead contaminated water and paint from old houses. If you need to undertake a project in the house, you need to delegate that. You need to avoid unwashed produce because they have pesticides. You also need to avoid working outside in the yard because of the when it comes to yard work, there is pesticides which will cause hormonal disturbances and disruptions. Also the fumes from the pesticides will cause permanent damage to respiratory, fetal respiratory. Sauna and hot bath are not recommended, especially because they cause neural tube defect. You need to avoid alcohol use, tobacco, and substance use. When it comes to all these, they causes miscarriage, preterm birth, and they can cause maternal hypertension and infection and hepatitis, especially to the mother when it comes to maybe using stuff like substances where you have to inject on the veins. So when it comes to alcohol use, you're exposing your fetal to alcohol syndrome, congenital defects and cognitive defects, withdrawal at birth. When it comes to tobacco use, like tobacco has nicotine, and this will expose your child to low birth weight, defects in the heart and the lung. You will expose your child to having permanent asthma and cognitive behavioral at birth. Things like ADHD and SIDS will be found with children with mothers who have exposed themselves to tobacco. When it comes to substance use, there's the heart and lung defects. You will expose your child to potential cleft palate, and your child will obviously show signs of withdrawal at birth and neonatal abstinence syndrome, which comes with substance use. When it comes to travel, if you need to travel, you need to consult with your doctor before you travel, but it is recommended on the second trimester, which has lower risks as opposed to first and third trimester. The best time to travel is in between 14 and 28 weeks. In case one has to travel, please bring with you your medical records, and just in case of an emergency. And in case you're driving for long distance, make sure to stop every 2 hours and to stretch and to take short walks. And during your travel, wear compression stockings, and make sure you're well hydrated. This will help prevent clots and to prevent DVT. In case of you want to get pregnant, planning to get pregnant, be sure to visit a dentist. This will help you identify old cavities before pregnancy, and if there are procedures that need to be done before pregnancy, it will be done. It is generally safe to see a dentist during pregnancy, but there are things that are recommended that may not be you may not be able to overtake during pregnancy. It is recommended to visit the dentist as much as possible because of the hormonal changes, things like morning sickness where you are vomiting, and this will cause corrosion with the cavity, with the teeth. Things like diet change and cravings will cause cavities, so it's very important to see the dentist during your pregnancy. Exercises that are recommended during pregnancy are those are safe from avoid contact sports like soccer, basketball, and things like that, and hockey. Avoid exercises that will cause trauma to the fetus, exercises that will cause back injuries. Avoid exercises like horse riding, skiing, intense working out like yoga, hot yoga and Pilates. Avoid what else? Do exercise, simple exercises that will involve stretching or walking that are not dangerous to the baby and to the mother. Avoid laying on the back because this constricts blood flow to the baby and may cause preterm birth. And in case you notice that the baby is not as active in the stomach as like kicking and praying, you need to consult a doctor and let the doctor know. What else? Limit travel during your third trimester because of mother's hypertension and preterm preeclampsia, and there are higher risks of preterm birth. Thank you.